I'm Dr. Ruben Gonzalez. I'm the Chief of Health Education and Diversity for the Napa-Solano service area. I'm also the Clinical Director for the Public Health Research Internship Program in Vallejo. My role with the public health interns is to help mentor them on certain projects that they do in the community. For instance, with my position as the Chief of Health Education, we're doing a lot of programming that affects our patients, not just within our walls, but also with extending it out into the community. One of the projects that we've been working on is what we call diabetes centering. It's a 6-week self-management program that's aimed really to teach our patients self-management skills that they're needed in order to manage their diabetes for the short term and in the long term. The other benefit that we have from diabetes centering is not just our health educators and patients that help each other, but we also have a clinical pharmacist that is able to do medication titration. So when patients come in, it really is a full service that they have the education on self-management skills. They learn how to put those skills, how to practice those skills by discussing barriers with other patients that have maybe shared those barriers or have overcome them. And then you also have the pharmacist that's ready at the moment to make sure that, since the patient's working on their self-management skills, that they also get their medications titrated in a fast and efficient manner, so patients don't have to come back and forth and get lost to follow-up or have to pay another copay in order just to get their medications managed. From my perspective, having an MPH student or a public health student, it's a natural collaboration, because usually public health really has a lot of the same principles that health education does. And having that kind of academic eye for these students who are studying the theories and are learning how to design these big systems, it's really good from our perspective, being a community-based hospital, be able to tap into that knowledge and really design programs that are evidence-based and that are going to be able to change people's lives and make sure that they live healthier and vibrant lives going forward. The other thing that's very beneficial for the students is that a lot of times, being very academic and having those theories, they don't really understand the practical challenges that may happen when you try to establish a program in the community. For instance, on paper, patients, typically do what you predict that they're going to do. In real life, there's a lot of reasons that there are barriers of care that they don't show up, or there's things that we have to overcome that sometimes we just can't predict. And the other thing that you can't really predict is how your staff reacts. And learning how designing programs, you also have to be aware that you're also changing culture that's within different departments, and how to navigate those different intricacies is really important for students to get hands-on experiences on. A lot of my projects have really been focused on reducing health disparities, whether it's been reducing health disparities within having our patients get advanced care planning. And we've had students that have been involved in writing literature searches for them, and we've had students that have been involved with helping us kind of understand kind of what we know about these patients or common barriers that the literature has found. We've also really been focused on diabetes, just because it is such a big condition that affects a lot of our underserved populations, especially African Americans and Latinos. The students have been able to, really do thorough evaluations of reasons why patients might not be as controlled as we may want them to. And one of the benefits of being at Kaiser Permanente is that we do have a large amount of information or data that we could look at to figure out why patients are not, being able to get the great control that we expect from them from a system that's so integrated and we have so much support for them. So they've been really instrumental in helping us figure out where are some issues with our systems that we could really address and make sure that our patients are getting what they need. Other projects that I've been involved with the students have really been involved with curricular changes. We from health education's perspective, we want to make sure that our curriculum not just teaches patients about the medical condition, but that they're learning the skills in order to overcome some of the self-management issues that they may have in order to change the condition that they're in. So the students have been very instrumental in making sure that they could help inform us if our curriculum is really up to standard from what the literature says and what other programs are doing that are effective. So one of the biggest value I've seen with having MPH students here is coming being trained in an academic center like the University of Washington, we always had access to professors or people that were doing, real kind of innovative and robust research. And traditionally and I also trained in a residency program that was very community-based, and we did not have that research culture. I think at Kaiser Permanente, by having our MPH students here, we do change the culture of the work that we do here. We're no longer just focused at seeing patients in the community, but we're also looking at, what the research shows and doing actual projects that is able to inform not only how we could change our policies and procedures here, but how we could really how we could showcase and have showcase what we're doing at KP in an evidence-based way, and be able to take those learnings and share them with other institutions that are probably struggling with the same issues and concerns.